Hi, everyone. Welcome here. I am so glad you could join us here today to learn more about pain and how we can start to change it and some of our thoughts about it and just what we know about pain in a lot of different ways. My name is Jennifer King. I am a registered social worker with the Saskatchewan Association of Social Workers, and I have 17 years of practice in healthcare and education. But no matter how much education and knowledge I have on this subject, you are really the expert in your own pain experience. And so, whenever you are talking with someone, I don't want you to forget that. I want you to remember that you know more about your situation and what you're going through than anyone else does. Um, the reason for that is that pain is subjective. Pain is different for everyone. And while we can all empathize and understand, and we can think about our own experiences and what we might be going through, um, pain is not just about a physical sensation or a physical feeling. It's really about our emotional experiences too, and everything that we've gone through in the past. And that really influences the type of pain that we're going through. So we can never truly know someone else's pain. And that's part of what makes pain so difficult to treat and manage, is because we really don't know exactly. And sometimes there are things that are causing pain that we just don't know enough about. So today in our session, we are going to cover the definitions of pain. We're going to talk a little bit about how it's processed, and I'm going to give you three strategies to help you start thinking about pain a little bit differently and to start thinking about your pain and how you manage. And so we're going to start by talking about how pain is a function, and it's a function of our body in order to protect us from harm and to avoid injury. It is a very protective factor, and it is a good thing that we have it. A book that I started reading quite some time ago, even before I really got into pain, was called The Gift of Pain, and it was written by a missionary doctor who worked with patients who have leprosy. And when they don't feel pain from the leprosy, they end up doing a lot of damage to their bodies. And so really understanding that this is a function that our body has in order to give us protection and in order to give us life and health. When our body isn't functioning properly, though, sometimes moving from acute pain into chronic pain, some things are happening in our body that the function isn't happening in the way that it's supposed to be. We're not going to get into a lot of the chronic pain information today, but just to make a note there that chronic pain and acute pain are two different things, and that the chronic pain, the function of pain isn't really functioning in the way that it was supposed to anymore. And so if we go back, there's usually an unpleasant situation that occurs, and that situation sends triggers throughout the body. It starts with the nerves and goes through the spinal cord into the brain, and your brain compares that experience to other things that you've had in the past. So let's take a moment and think about a toddler who walks over to the stove, and the adult who's in the room, who's in charge, they turn the toddler away and they say, "No, that's hot, no touch." And so they move the toddler away, and they keep working in the kitchen. The toddler comes back, and this process repeats several times. Then the last time, and it's going to be the last time because pain occurs, is that the toddler comes to the stove, the adult doesn't make it there in time, and the toddler touches the stove, and the heat from the stove comes into contact with the skin. The skin has some nociceptors in there, and those perceive an unpleasant experience and start sending messages up to the brain. This happens really fast because what happens is the toddler pulls away. They have a function of pain that protects them and pulls themselves away from there. But the burn's already happened. And so they now know that they can associate a hot stove with pain and with something that hurts. Now, beyond the actual physical experience that they've had, they also have an emotional experience. And that adult who is in the room with them is going to react in different ways. Maybe they have a really caring role and they say, "Oh, I'm so sorry you got hurt. let's quickly get this under some cold water, cool water, make sure that we take care of it and, do kind of take care of you. Some caregivers, however, don't have so much empathy and compassion, and they might say things like, "See, I told you it was hot. Why didn't you listen to me? Can't you, didn't you know?" And they kind of berate the toddler. And so this toddler now has two possible emotions attached with this pain experience. And so if we take a look at the International Association for the Study of Pain, they are called the IASP, and they're an organization that focuses on pain and research. There is it's a worldwide group that gets together, and they are working through trying to figure out how to define pain. And it's not an easy task. And so right now, what they have is that pain is an unpleasant sensory and emotional experience associated with the actual or potential tissue damage, or described in terms of such damage. And so pain is not just that physical sensory that we often think that it is. There is a really large component of emotional experience that goes along with it as well. And it's not just actual damage, it's the potential damage. So we can have this anticipatory pain as well. And, expecting that something might be painful is part of that pain experience. Now, we are wanting you to know, too, that pain is not always communicated in the way that we think there is, with kind of that facial grimacing or pulling back or things like that. Sometimes people who don't show pain are experiencing pain. And there's a lot of reasons for that, and some of that is emotional as well. The IASP also says that, it's because it's unpleasant, that's what makes it that emotional experience. But they also say that many people report pain in the absence of tissue damage or any likely pathophysiological cause. And this usually happens for psychological reasons. Now, I think it's really important to note here that just because we're saying that pain is processed in the brain, and actually pain isn't felt until it's processed into the brain, even though we're saying that, and even though we're saying that, there may be an absence of tissue damage, the function of pain is still there. And there's a reason for that function of pain. And it's really important to understand kind of that emotional side then. Like what is the emotional cause for some of this pain to continue, even though there's no seeming pathological thing. The other thing to note is sometimes there is a pathological thing that just hasn't been found yet. And so sometimes you're going to have to find that you're going to have to be really persistent and be your own advocate to figure out what that source of pain is. And that's what makes this really tricky is how much of it is that physiological pain and how much is the psychological pain, except that no matter what it is, both of these aspects should be working together or should be taken into account when going through any kind of finding out what pain is being caused by. What else do I want to share here? I think we want to talk a little bit about, so this whole way that pain is perceived and kind of the uptake into the brain, the activity, so the IASP says the activity induced in the nociceptor and nociceptive pathways by a noxious stimulus is not pain, which is always a psychological state, even though we may well appreciate that pain most often has a proximate physical cause. So essentially what this is saying is that when you turn on a light switch, it's not the light switch that is light. And so, we have all of these wires in our homes that take electricity and move power through. And it's kind of that light switch that actually allows that pathway to happen, right? It allows that pathway to the light. And when the light goes on, we have light. And so the pain is the light. But we have these light switches around the house, and those allow pain pathways in our body, and those are called the nociceptive pathways. So the pain is taken through these nociceptive pathways up into the brain. The brain is like the circuit box. It allows all the connections and everything else to happen, and it sends a message back out and down to where it needs to go. So if we think about it, we have these switches that we can either turn pain on or off, but we also have dials. And in our house, we have a few lights around our house with dimmer switches, and we can turn up how much light we want in the room depending on the time of day, and we are in control of those things. Pain has those same types of dials and switches and turn off things. And we can think about this in the way that a football player on the field gets injured, they keep going and don't show anything, or maybe they don't show any emotion, or but afterwards, when all of the hype is done and everything else is done, they could be showing or expressing pain in a much more severe way. Does that mean they weren't hurt before? No, it just means that there was a switch that was just preventing them from maybe expressing it or feeling it to quite the extent that maybe the injury was. So I guess that's part of the emotional thing too, is when we're aware of our emotions and when we're aware of our surroundings, we have some control over, those switches and how things go. Now, let's move on here. Pain signals received in the brain. Pain overlaps with a lot of areas in our brain as well. It's not just received in one area of our brain. It's received in a lot of areas of our brain. And we know, and maybe I'll go into this in a future video, but we've got kind of our fear response, our emotions, and our thinking part of our brain, and they all have to work together. They all have to be in communication and working together. Pain kind of overlaps all of these areas. And so when we're talking about being stressed, stress can really influence our pain and increase our pain. And so we really want to think about, that overlap. And that's why psychological methods are really effective, because they are overlapping some of those things. And if we can increase a certain area of our brain and the function of it, it can maybe change that dial and change the pain that is being felt. So I know I've been trying to make a case for the emotional, psychological component of pain, but that's not the only way that we manage pain. In the Western society here, we often focus first on stopping pain, and usually that's by going to a doctor, taking medication. Sometimes it's even going as far as surgery and making sure that we are getting it fixed. We want to fix pain. We want to get rid of pain. Nothing wrong with that in and of itself, but we also want to make sure that we're kind of taking a look at pain as a whole. And so there are certainly some pharmacological interventions. There's physical interventions, which could include surgery, but physical interventions could also include massage, physical therapy, chiropractic, other types of things along that line. We also have preventative work when it comes to pain. And so you can prevent pain from occurring or from flaring up or getting worse by taking care of yourself, by making sure that you're doing the right kinds of movements, by having the right kind of posture, things like that, but also just taking care of yourself in general. And then there's the psychological aspects of pain, which we're going to talk a little bit more later. And I really think I'm probably biased, but I believe that the psychological aspect of pain is the basis for other treatments being effective. And this is because there are studies out there that show that the way that people go into a treatment has a great effect on the treatment outcome. So if you go into a treatment, no matter what it is, if it's surgery or medication or other things, if you believe that that's going to work, your outcomes of success are likely going to be increased than people who don't believe that it's going to work, or believe that it might have a negative outcome, or they fear, what might happen to them if they do something like that, and they'll have poorer outcomes. And so this mind-body connection that we really try to disconnect the two. And yet the mind-body connection is really powerful. And our mindset is really the most important factor in pain management, as pain is an emotional experience that is processed in the mind. And so even for chronic pain, I really believe that your pain is real, and that one of the most important places to start addressing that is your emotional experience of that pain. So I'm going to give you 3 things that I want you to consider trying and doing. And these things are probably things that you have not heard about when it comes to pain management. The first one is that I want you to start noticing your pain. And as I say that, you're probably like, Jen, that's all I can notice. That's all I'm noticing is pain. Yeah, I understand. I know, because, and I don't know about you, but for me, I really become kind of internal when I am experience pain. I kind of forget about the world outside of me. I kind of focus and draw myself inside. And so, yeah, I understand that you are probably going to say, that's all I notice. That's all I have is pain. I want you to challenge yourself, though, and to start moving beyond just feeling the pain. I want you to become really aware of the type of pain that you have. I want you to start thinking about what kind of words would you use to describe the pain? Is it dull, throbbing, pins and needles, sharp, searing? What are some other words that you could use? Aching or dull. And so there's a lot of words that can describe our pain. And if we really start to think about it, it helps whoever is helping you, especially your physicians or a specialist, if you know how to describe your pain to them with words, they can start to help you better, because there are certain words that describe different types of pain. So the more aware you are of how your pain feels and what kind of words to use, the better outcomes you will likely have with treatment. Beyond using words to describe that pain, though, I want you to also pay attention to where the pain ends and where it begins. And this might be difficult for someone experiencing more of the autoimmune or even like something like fibromyalgia, where it feels like the entire system is in pain. Except even in those cases, it might be a reach for you, but try and think about where the pain begins and where it ends. Usually there's a beginning and an end, but we just don't get, when we're overwhelmed with the emotion of pain, we don't feel it or sense it. So try to start to explore and see if in your body there is a beginning to pain or if there's an end to pain. And while you're doing that, see what the edges of that pain feel like. Are they soft, and do they kind of just float into the rest of your body? Or are there sharp kind of edges around, or really detailed, ways that you would describe your pain, that it's really rigid? Then what I want you to do is, and this one's going to seem really strange, but some of you who are visual are going to find this easier than other people. See if there's a color to your pain. See if you can describe it, or see if you can see if there's kind of this sense of if there's a color to that pain. And it could be any color, but just notice if there's something there. So undoubtedly, this is going to be a really difficult exercise for you to be doing. Maybe having someone walk through this with you, or just slowly, if this is a record, you can pause and think about these things as I walk through them. But what it starts to do is that you can start to notice what that pain feels like, and the ebbs and the flows of pain, because pain is generally not static. It's not stuck in one thing. It usually does change a little bit. And so for you to start noticing, what changes about my pain, what times of day are better, what times of day are worse, and what am I doing around those things that are kind of making it better or worse? And starting to notice those things are going to help you to maybe think about some other, the next 2 things that I have on here as well. The second thing I want you to try is to start moving your body, but to start moving it in a much gentler way than maybe you have before. Maybe you've had to push through and do things no matter what. Or maybe you've become really sedentary and you've started to just guard yourself and not allowed yourself to move. So what we want to do is kind of find the balance between those two. And there's a lot of times where I say, oh, we need to find that balance between two things. And this is one of those cases. Yes, rest is important. Overdoing it is not good necessarily, but only resting isn't good for us either. And so we really want to start, as you notice your pain from that first thing, from the first tip that I'm giving you. The second thing is, as you've become aware of your pain and where it is, now I want you to really get a sense of what movement can you do without causing a lot of pain. And it might not be much. It might just be really limited. But as you sit with that and you say, okay, this is what I can do. I can move, it might just be as simple as I can talk and moving my face doesn't cause me pain. And so if that's where you can start, if that's what's the least amount of pain and that's your range, start there. And then maybe try and play with that a little bit and try and expand it into, another area of your body where you might not be having pain, but, and just seeing what your body is able to do with the most comfort. Oftentimes when we start a movement program or an exercise program, we start with the end goal, but like, this is what I want to be doing in the end. And so I'm going to start there. And that really does a lot of harm to our bodies. Slow it down. Take small steps. And when you do that, your body kind of realizes that it doesn't have to guard against the pain, or it doesn't have to protect against that pain all the time. And when you are respectful of your body and your mind and your emotions around it, it's easier to start saying, okay, I'm moving towards my end goal, but it doesn't mean I have to be doing that right now, causing myself pain. Always work with your physiotherapist and the other people who are helping you with movement and pain, and talk to them about some of this as well. Finally, okay, we're going to get to our last one. You may need to start changing some habits that you are in, and that could be sitting too long or standing too long, and those could be job-related things. So if you get home at the end of the day and you sat all day because that's what your job required, that can be a complicated thing to kind of figure out, right? Not drinking enough water, that's a habit that we all probably need to work on. But we also need to think about, avoidance of things. And that's a habit too, a habit of avoiding the things that we know we're supposed to do. So, you know that you're supposed to be doing some stretches from the physio, you're avoiding them. You know that your doctor gave you the recommendation, you're avoiding it. And so that can sometimes be a habit as well. It's important to recognize and understand the why you're doing that. Is it, again, a protective factor? Do you really believe that what they have given you is going to help you at all in your situation? And so there might be reasons that you have caught yourself up in this habit that you just haven't really worked through. And it's easier just to avoid than actually do the work sometimes. It is. And so really we want to start to challenge that, challenge what you're doing and what your habits are. And one of the ways, if we go back to that emotional thing, is, do you really care enough about yourself and about your body to take care of it and to give it what it needs? And do you care, or are you just going to push through? I know for some people that I've worked with, the habit of using alcohol to numb the pain, whether it's emotional and or physical pain from the past, that's a habit, and it's easier sometimes than addressing that pain behind it. And so although not taking medication when it's a recommendation, that could also be a habit and something that you grew up with, and you avoid that, putting extra stuff in your body, and so you want to avoid that. Do you care enough about yourself, though, to interrupt some of those patterns and to start working with someone about that emotional piece of it and what's keeping you stuck in some of those bad habits? None of these three things are easy. And I don't expect you to be at the end goal with any of these, by next week. But what I want to do by talking about these things is sometimes just being aware of it. Sometimes just that thought. needs to be in our mind, and we have to just kind of think it over and kind of make sense of it before we can actually take that next step. And so that's what I'm hoping to do with these suggestions, is that you just start thinking about it and you just start opening yourself up to the possibility of using some of these things. Now, I do want to say, if you feel like you do need some additional support, I want you to consider reaching out to a professional who knows and understands pain, to start to connect with someone who really does understand the function of pain in both the physical or physiological part of pain, as well as the emotional part of pain. And that might mean going to a couple different people. The IASP, and I wholeheartedly agree with this, recommends a multidisciplinary or interdisciplinary approach to pain management. Unfortunately, I know that a lot of places in the world are really far behind on actually providing that. And so as a patient or as a client of services, you are the one, you're almost like this healthcare manager, in that you're kind of going to the places that you need to, and getting the information that you need to bring it together and make it work for you. And so sometimes that means going to several different people for what you need. When I meet with patients, I offer a lot of psychological strategies for pain management, and this can include things like distraction techniques, mindfulness, working through a type of therapy called acceptance and commitment therapy, where we kind of look at 6 different core pillars of developing kind of a flexible way of thinking. I also explore your environment and relationships, because pain is influenced by so many things, and so many things influence our pain. And we'll get into that in another video, the things that kind of make our pain worse, or the things that end up creating pain and causing pain for us, and how we can take a look at some strategies for that. We also get into relationships, connection. Isolation becomes a really big thing when you have pain. And so I work with people to talk about how to come out of that isolation, develop some relationships, and some healthy mutual relationships, which is really ideal. We also talk about relaxation techniques and grounding, which I believe are really important to notice your body and to get grounded into your body. Doing that is something that I use a lot with my clients on calming down the fear response and just allowing the body to kind of settle and to become grounded. And it's a really gentle and effective way to do that. So you can contact me online. You can contact me through Facebook Messenger. You can email me. You can take a look at my online booking right now. As of today, it is beginning of January, and the 15th, it's the middle of January. January 15th, I am mostly doing online consults right now. I'm looking for a physical space to operate out of to offer my counseling services. So at this point, I am taking online bookings. So if you want to just talk through some pain strategies and talk through your experience so far, we can do that online. And if you're in the Saskatoon area or north of Saskatoon, I am looking for a physical space to work out as well. So keep checking back and let me know if you have any questions, and we can get contact or get connected that way. Follow me on Facebook. Give me a thumbs up if this has been helpful, and make sure you share it with other people as well. So I just want to say, there will be more sessions coming up. I hope that this has been helpful, and we will talk again soon. Thanks.